Welcome everybody. Welcome everybody to PHRI Research Day. First, it's wonderful to see so many of you here.
A day like today brings everybody together. It gives a chance to share the extraordinary science that's going on here, to have people engaged, to learn what's happening, but also to contribute to the science by reading posters, listening to presentations, and commenting, giving their thoughts and advice.
There's a buzz to research, and the excitement of doing the research, and very importantly walking through the posters and seeing the range of posters and the pride that some of the young investigators or trainees have in the research, it's very exciting. So having them participate in the process, catch the buzz, get recognized, I think is really important.
The researchers at PHRI are focused on clinically important, relevant problems. The questions that are being answered are ones that they see every day in the hospital when they see patients, or every day in the clinic.
We as a group are passionate about reaching out to other countries' health systems, but also populations who may not have the same access to health resources and health care. And we do that using observational health studies and ask what makes some populations healthy and other populations sick.
We're concerned with making a global impact on improving perioperative outcomes.
We have a vision for being able to decrease 30-day postoperative mortality and adverse events. The research process is informing the design of the technology itself.
I would say at PHRI we embrace networking and collaboration as at the very heart of globally impactful research.
You know, the days where a scientist could make discoveries on his own, like Galileo looking through his telescope, is now over. And the only way that we can solve these very difficult problems is when a group of people all work together towards a common goal.
Because we work together, we have converted stroke from a horrible condition to a reversible, relatively minor problem.
And this required nothing less than the reorganization of the healthcare system. And the work in Canada became the model followed by the rest of the world.
Much of the research that PHRI has done over the last 20 years has very fundamentally and substantively changed healthcare very soon after the research was completed.
To say they have a global impact is like an understatement. It's amazing their impact.
Just 2 weeks ago, we were at the European Society of Cardiology, and I think we were one of the 4 or 5 institutions that had the biggest impact at what was the biggest meeting in the world in cardiovascular disease. Last year, we had, 452 papers, which is more than 1 per waking day.
It's quite remarkable how consistently high quality research is done at this institute and is being shown and presented today.